I don't know what the just happened for the past 13 hours. Honestly, guys, it felt like I was working in a war zone. Completely isolated from my team members, limited resources, limited supplies, limited responses from physicians because they're just as overwhelmed as we are. I just spent the last 13 hours treating 2 critically ill COVID patients basically by myself. And this is my new normal for the next however many months that it takes for this virus to die down. So, I'm already breaking. So, people, please take this seriously. This is so bad.
Hello, my name is Julie Snook and welcome to 9 News Watch. That emotional plea you just heard comes from intensive care nurse Melissa Steiner, who works at a hospital in Michigan. There have been 60 deaths so far in that US state. The United States today overtaking China and Italy with the most COVID-19 cases in the world. They have, though, recorded fewer deaths. Let's get you up to speed with what we know today, and the Australian death toll has reached 13 after a Western Australian passenger on board an unnamed cruise ship died. From midnight tomorrow, anyone arriving in Australia will be quarantined for 2 weeks in hotels or other accommodation. There are now more than 3,000 cases here in Australia. 162 of those are from the Ruby Princess cruise ship after 41 more cases were discovered from the virus-plagued ship which docked in Sydney. Global infections have now passed 500,000. The death toll in Europe alone has passed 15,000. G20 leaders have vowed to inject $4.8 trillion into the economy after a virtual meeting. In some positive news, Woolworths is taking on 20,000 new workers, and the French government says the Tour de France could proceed without spectators, making it the only sporting event taking place in the world. Prime Minister Scott Morrison has announced everyone arriving at an international airport in Australia will be required to go into quarantine. Those returning from overseas will be put up in hotels and other accommodation in the state in which they land for mandatory 14 days of quarantine. 2/3 of those with the virus have flown internationally, and many others have contracted the virus from them. The crackdown will come into effect at midnight tomorrow.
So by no later than midnight tomorrow, that's 11:59 p.m. Saturday, states and territories will be quarantining all arrivals through our airports in hotels and other accommodation facilities for the 2 weeks of their mandatory self-isolation.
The PM also thanked Australians for changing the way that we're behaving and, in the process, saving lives. With an eye towards the weekend, he asked us to continue to keep our distance. He also encouraged Aussies to stay in touch with each other.
It's a big change to our way of life, but we're staying connected to each other. We might have to keep our distance, but it doesn't mean we have to disconnect from each other. This is also a very important message about supporting each other, supporting each other's mental health, and ensuring that no Australian, even though we have to be isolated, no Australian should have to go through this alone.
It's certainly a timely reminder. Well, back to the COVID crisis in the United States now, and numbers are soaring in New York. Here is US correspondent Alexis Daish.
Well, as predicted, here in New York, hospitals are really starting to struggle to cope with the number of victims at the hands of this infectious disease. In particular, there is one hospital that is right on the front line. It's called Elmhurst Hospital. It's in Queens, and in the space of 24 hours, 13 patients have died. Some of those patients died before they even got a hospital bed while they were waiting in the emergency room. Obviously, awful news, and remember, that is just one of New York City's hospitals that is trying to deal with this pandemic right now. There is another hospital in Manhattan, Bellevue Hospital, where the military has moved in. They have set up essentially a makeshift morgue with tents set up there to take in victims and refrigerated trailers. So look, the situation here is very, very grim. The Governor of New York has really stepped up. He has been updating New Yorkers every single day, looking at hospitalisation rates, looking at the increasing number of positive cases. And today he gave this city some advice that I think everyone could take something from.
When the pressure is on, is when you really see what people are made of. In a personal relationship, in a business relationship, people can be great when everything is great. The question is, what does a person do when things aren't great?
Looking at the bigger picture across the country, well, we now know 3.3 million Americans have filed unemployment claims. To give you some perspective, that is bigger than the entire population of Brisbane.
To some non-COVID-19 news now, and Meghan Markle has landed her first job since stepping back from the royal family, and it's with Disney. But she won't be playing a princess. The Duchess of Sussex is narrating a new show titled Elephant, which will premiere next week. Now, you might recall husband Harry had a bit of a chat with the Disney CEO at the London premiere of The Lion King last year. So it looks like that might have just done the trick. Well, Sarah Fardy is a viral immunologist, which puts her in good stead to understand viruses and pandemics like we're currently experiencing. Now, she has this fantastic page on Facebook called Fardy Facts. So, to help us out, she shared her top 5 hygiene tips we can use in and around the home. Take a look.
Hi Julie, and thanks for letting me help your viewers stay safe during the COVID-19 infodemic. Let's get straight into my top 5 tips on how to stay safe so far. Number 1, wash your hands with foaming soap and water. Build up a lather with your soap and wash mechanically for 20 seconds. It's very important to have that 20 seconds of mechanical washing to remove the virus from your skin. My number 2 tip is do not touch your face. The virus enters through our eyes, our nose and our mouth. If we're not touching our face, the virus can't enter. If you're finding it difficult to stop touching your face, especially for children, I have a hack for you. You too can make some superhero gloves and help your kids to stop touching their face and fight the virus. My number 3 tip is to enact social distancing. Choose who's going to be in your bubble and keep it that way. You can only leave your bubble if you are going to get food, you are part of an essential service, you need to go to work, and if you're going outdoors to exercise. It's very important to enact social distancing so we can flatten the curve. Flattening the curve means that the healthcare systems can cope with critical care COVID-19 patients, and it gives more time to scientists to come up with a vaccine and other therapies that might help us. My number 4 tip is to clean your surfaces with an appropriate disinfectant. Not all disinfectants we have are appropriate for killing viruses. There are some wipes and different detergents that simply do not cut it. Viruses are very, very tricky, and we need to hit them with the appropriate disinfectant so that we can remove them from surfaces so that we don't pick them up on our hands. You need something that foams with soap, or you need something with more than 60% ethanol in order to knock these viruses out. If you're using an ethanol-based or alcohol-based sanitizer, you need to allow these things to air dry, whether it be on surfaces or your hands. And if you're using the foaming detergents, you need to allow a little bit of contact time, then get your elbow grease in there and wipe those bugs away. My number 5 tip is stay healthy, active and positive. You need to look after yourself. Eat the right things and stay away from processed foods. You need to be as healthy as possible during this time. And sneak in 30 minutes of exercise every day for adults and 1 hour for kids. You also need to be measuring your temperature every day at the same time with the same thermometer. Work out your average temperature. If your temperature spikes or goes above 38 degrees specifically, you may have a virus infection. It's very important for us to be monitoring this right now. You need to stay positive because we're all in this together and it will not last forever. Everything we are doing right now is to save lives. Stay safe and wash your hands.
Oh, Sarah, thank you so much. Some fantastic tips there. If you have more questions for Sarah, you can visit fardyfacts.com.au. Well, not only is he saving lives at a Brisbane hospital, but this singing surgeon is also putting smiles on patients' faces, serenading the audience with his rendition of Waiting on the World to Change. The surgeon shares a special message.
Waiting on the world to change. So you can change the world. Just wash your hands. Exactly. Wash your hands. We keep on waiting. Waiting on the world to change.
We need a little bit of that in our day, don't we? Well, thank you so much for joining us on 9 News Watch for what has been a rather unforgettable week across the world. We wanted to leave you with something uplifting for the weekend, and I think this is a wonderful display of humanity at its kindest. Millions of people across the UK stopped at exactly 8 p.m. last night to applaud those working on the front line in the fight against COVID-19. Across Britain, monuments, bridges and buildings turned blue in honour of the National Health Service for the Clap for Carers initiative. The Prime Minister joining outside 10 Downing Street, while the young members of the royal family also paid tribute. And from the NHS, these simple words. That was emotional.